My responsibility at Advantage Dental Plus as the VP of Clinical Affairs really focuses on three areas. One is obviously clinical safety, clinical quality assurance. Second is risk in the risk department, mitigating risk, ensuring that we're compliant with all rules and regulations, both state and federal. And then most importantly is really the clinical activities that go on in the practice, meaning that ensuring that our practices are providing care that's in alignment with the owners of the practices and their philosophy of care, and that our providers are following the policies and procedures that are set forth in there. I did wet finger dentistry for 30 years, so I certainly understand all the trials and tribulations of what it takes both from a team aspect and individually to deliver appropriate care. I'm able to let that shape my decisions in the leadership role within Advantage Dental Plus in a way that I feel really supports our organization. So fast forward, and we were expanding into the Florida market, and we were looking for ways to improve our workflows, our processes, control inventory, and the Zerk team and the color method really struck home for us. And we've had the pleasure of working with them. This is our 9th or 10th practice that we've now either a de novo or an acquisition. I just believe in making things simpler, really. I mean, really looking at it, controlling costs. I've been a business owner. Make it easy to bring people on and cross-train the team. Philosophically, it just aligns with that. And as someone who's involved with 80-plus practices on there, we're implementing now in our acquisitions and de novos, but we also are seeing the benefits and making our plans of how can we implement that in our other existing practices that we haven't converted yet. You know, this is an undertaking, and it doesn't happen overnight. There's a lot of planning to do this, but philosophically, if the end of the road is happier staff, more efficient, less waste, easier to, empower and train people, it's a no-brainer for me.